Indoor tanning devices, often referred to as tanning beds, can be dangerous, especially to teenagers and young adults who don't fully understand how these devices operate. Joining me today to discuss this issue is Dr. SABRA Sullivan, a board-certified dermatologist from Jackson, Mississippi, and also a nationally known expert and leader in dermatology advocacy. Also with me today is GAYLE WICKER, wife of U.S. Senator Roger Wicker, and a member of the Congressional Families Cancer Prevention Program. Thank you both so much for being here today.
Thank you.
Before we get into the specifics of indoor tanning devices, Dr. Sullivan, would you explain generally why is exposure to the sun dangerous, and tell me a little bit about UV radiation and exposure?
I'd be glad to do that. You know, we're all exposed to UV irradiation if we are alive and we go outside, and going out and being exposed to the sun is not a bad thing, but too much is. We know UV irradiation is a carcinogen. In fact, it causes cancer too much if we have too much of it. And UV radiation in moderation we're all going to experience, but trying to get increased doses of it or to get a tan-like color to your skin is not a safe and healthy thing, and it increases your incidence or your development of skin cancer, particularly if you start tanning early in life.
And Mrs. Wicker, I understand you're very much concerned and deeply, involved in this issue.
Well, yes, I appreciate having the opportunity to be a spokesperson for this. The number of teenage girls who are using indoor tanning devices is alarming, and of course, as Dr. Sullivan said, for women 39 and under who use tanning devices, it increases their lifetime risk of melanoma by over 75%.
And Dr. Sullivan, a lot of people under the misguided information that using a tanning bed is safer than being out in the sun, but that's not the case, is it?
That absolutely is not the case. When you're in a tanning bed, you are getting unregulated UV radiation. These bulbs everyone is not the same. You can get large quantities of UV radiation, and even if you don't get a burn, you can suffer some dire consequences from that repeated exposure to high intensity UV. There's been a study out that actually shows some people think it's better to go get a preventative tan so they don't burn when they go to the beach. But those people still have a much higher incidence, and this is scientific and looked at in a study, of developing skin cancer over people who just went to the beach. So there is definitely a danger in using a tanning bed and developing skin cancer, particularly in using it as a young person.
So what I'm hearing is that tanning beds are generally not safe for teens, but they're still using them. What are your thoughts on that, Mrs. Wicker?
Well, as we know, when you're a teenager, you're often very concerned about your looks, and there's so much focus in our society on how somebody looks. And but the dangers are real, and one of the statistics that to me is just stunning is that as I think Dr. Sullivan said earlier, your chance of developing melanoma is increased by 59%. And the danger of these ultraviolet rays from tanning devices is real. It's so real that the Federal Drug Administration has actually put a black box warning on these devices, which is the highest warning that you can get. And so the science is real. These are harmful, and they're particularly harmful to young women and to teenage women who are 18 and younger.
Well, Dr. Sullivan, as a physician, what do you tell your patients regarding indoor tanning devices?
Well, most of the time they don't want to hear me talk about it, but I do it anyway to everyone, not just my underage, but especially my underage patients. Yesterday, I took a severely dysplastic nevus, which is almost a melanoma, not quite, but off a young woman who's got a promising career as a nurse I've known since a child, and it's not the first who uses a tanning bed. And I told her about the number of women that I've treated in their early 20s that have come to me when they're ready to be married and have their children and worried about whether they'll die before they have their children of metastatic melanoma. or of the young woman that I took a melanoma off of, an invasive melanoma at 17, and she quit her job at the tanning bed salon at that time, and how she's lived through the years with always wondering, is there going to be another one, or am I going to have another disease? Will I see my children grow up? I tell them there's data now that we know. We're not just, you know, being old people saying don't have fun, but that there are many safe ways to get the look of a tan. You can have a spray tan, or you don't have to hide and not go have fun. You can go out and play baseball and go to the football game or go on your cruise. You just play safe in the sun, and you try not to go for that burnt-like tan, so you can have a look without the danger. But that the reality of what's happening here is that people are dying, and they could prevent. If I ask any one of my melanoma patients, particularly my younger ones with children, if they knew that they could have perhaps prevented this from happening by simply not going to that tanning bed early on, what would they have done? And no one says I would have still gone. And I think it's our duty, and particularly here in Mississippi, because we're all proud to be here in Mississippi and of our state, that we educate and warn about these dangers, and that we reach the same level our neighboring state, Louisiana. You can't go to the tanning bed if you're under 18. That we educate and we inform the public of these dangers. It's a public health issue. It's not a should I or shouldn't he, or you're controlling something. It's public health, and it's one thing we can do to prevent cancer that's quite easy. And they get to hear this every time they come in, and I've even been caught because some of the fake tans look real, and I go, are you going to the tanning bed? They're like, no, it's this. And I'm like, well, what brand? But the look of a tan is not bad, but it's definite. It's a fact we need to play safe in the sun, and we particularly need to protect our younger citizens that may not, like we said, you're growing up, you go with the crowd, you do everything to help educate and let them know what the dangers really are. So we hope very much that people will hear, teenagers, you know, young adults, and know that this is not harmless and it can seriously affect their life. And if for nothing else, I tell my young women, this is the cause of aging. Most people put sunscreen on their face, but you're going to look 20 or 30 years younger if you don't go to the tanning beds, or if you protect your skin, than if you didn't. So they all hear and they all know, and we're making a difference. The states that have decreased incidence, we're going to be able to follow and see the decreased incidence of melanoma. Do you know melanoma is the second most cancer in young women between 15 and 29 that we have? We can stop this, and beginning to not let our young people go to tanning beds before 18 is one step in the right direction.
Well, I'm sure some of the viewers are very surprised at the number of patients and the types of conditions they have as a result of this exposure. Mrs. Wicker, do you have anything to add as far as what is being done to maybe protect teens from this danger?
Well, we have learned, and we know that several states have passed a law that prohibits the use of tanning devices by teenagers 18 and under. And as was just mentioned, in those states, you see a significant decrease in the number of teenagers who are using the tanning beds.
And would it be your opinion that the state of Mississippi needs to follow the lead of some of these other states?
Yes, I do believe that Mississippi should pass a law prohibiting the use of these tanning beds for teenagers 18 and under. You know, sometimes as a parent, it's easier to say you cannot do this because you will actually be breaking the law. And so to me, this is just something that parents could use. If there's no law, even with the FDA black box warning, that's just a warning, and there's nothing to prevent people who are 18 and under going. And hopefully, as we grow older, our judgment becomes better, and when we see a warning and realize how significant that warning is, that it's a danger to the person who uses it, hopefully it would make you think and realize, I don't want to do this. But you know, you're still developing when you're 18, 17, 16, 15, 14, 13. And I just think a law prohibiting the use of tanning beds by minors would be a significant step in protecting the children and the youth of Mississippi.
Well, I imagine there are already parents and many others in the state that are concerned and want to help, you know, with this issue. Is there a way they can get involved? What should they do?
Well, absolutely. One of the best ways to do this is for them to contact their state senator or their state representative, because what we would like to see is this law come out of our state legislature. And a lot of times, unless legislators hear from their constituents, they're not really aware of the concerns. And if a state senator or state representative hears from his constituents, that could possibly make a huge difference in whether this law is passed or not. So I encourage people to write, or all of the time that my husband's been in public office, our phone number has been in the phone book. It's still in the Tupelo phone book. So if you know your state representative's phone number, I even suggest a call. Always be pleasant, but point out why you're concerned and why you see the need for this law.
Well, thank you both so much for being with us today and sharing this important information. And if you would like to learn more or to get involved, please contact the American Cancer Society Cancer Action Network or go to their website.